I remember being in hospital on one occasion with depression. I've been in hospital a couple of times during my career, and looking around me and seeing all the other professionals who were there as well, and talking to them, realising just how scared they were in terms of what they were experiencing. And now, I know that you can actually suffer from a mental illness, and in most cases you can continue working. Many of these people, though, thought their careers were over, and I thought that was really unfair, and I wanted to do something to change it. So I talked to a number of other people in the city who felt the same way, and we went about creating the City Mental Health Alliance to try and create some change and to make an environment where people could openly discuss mental health in the way that they can physical health. The most recent figures I've seen suggest that 90% or more than 90% of people would be afraid to disclose their mental health condition in the workplace. And actually, I've had experience of talking to many people and counselling people who are afraid of disclosing. I think there still, unfortunately, is a real genuine fear that people will be discriminated against if they disclose their mental health condition. On the other side, I have come across lots of situations where people have disclosed their mental health condition and been really surprised by the support that their workers, their co-workers, their colleagues, their bosses have given to them. But I think there's still a long way to go in terms of businesses dealing with mental health in the right way. So what would my advice be to somebody who is suffering a mental health condition at work? The first thing to remember is that you're not alone. So there's 1 in 6 people in the UK who will suffer at work from a mental health condition. So there'll be colleagues and other people at work who have suffered. The most important thing you can do is to talk about it. So if you're suffering, whether it's depression, anxiety or any other type of mental health condition, talk to somebody that you trust. That might be a friend, it might be someone in occupational health, it might be a psychologist, it could be a trusted colleague or so on. Many larger employers now have systems, confidential hotlines that you can ring to discuss issues that you might confront. I think I'd emphasise that really the most important thing is to talk about it. You're not alone, and there are plenty of people around who can help you.